everyone. Welcome to our live session. My name is Noafika. I am audiologist from 20dB Hearing and I'm your host for today. So today we would like to have a discussion session with a speech therapist, Miss Lim, and we will discuss about the interesting topic of what is speech delay and what we can do about it. So, as parents and caregiver, I believe that we often wonder if our children's speech development is on track or if there may be an underlying issue that caused a delay. So today we will explore what speech delay is with our expert speech therapist and share her insight and experience on this crucial topic. So we are honored, to invite our guest speaker, Miss Lim, which is a senior speech language pathologist, SLP, and graduated in August 2009 and has vast experience in serving clients with different communication disabilities. She also has a strong background and interest in serving preschool pediatric groups with autism spectrum disorder and hearing impairment. She holds specialization in several programs, including Certified in Talk Ability, the Hanen program for parents of verbal children on the autism spectrum. And then she also has a Certified in More Than Words, the Hanen program for parents of children with autism spectrum disorder or social communication difficulties. And she also trained in a few programs related to social skills, including peer school-based program, social thinking, and talk about social skills program, accessing and teaching social skills. She has a vast experience in working as SLP in Malaysia and Singapore, and now she currently spends most of her time at 20dB Hearing Ipoh. So hi and good day, Miss Lim.
Hi,
How are you today?
I'm feeling good.
Okay, that's great to hear that. So now, let's proceed with our session today and address some common questions from our community regarding speech delay. Okay, so Miss Lin, I often receive questions from parents who have faced difficulty in knowing the appropriate milestone for their children language development. So Miss Lin, as an experienced SLP, we love for you to share with us the typical language development milestone for children. And can you walk with us through when children typically start saying their first words and forming simple sentences? And additionally, what are some other important language milestones that parents and caregivers should be aware of?
Are you able to hear me?
Yes.
Okay. So children get their first word by the age of 12 to 18 months old. And most babies can actually use simple words like mama and baba at that age. So by about 2 years old, they have about 25 words and start to use two-word phrases. For example, mommy open. So by the age of 3, children use at least 200 words and they can ask for things by name, and their speech can be understood by family members quite well. By age 4, they should be able to say sentences with 5 or more words. I think it can be challenging for the audience to remember the milestone just by listening to me. So I would like to share a useful resource from Centers for Disease Control and Prevention, which is CDC. And they have categorized the development milestones into 4 main aspects according to age, including social, emotional, language, cognitive, and physical development. So you can, if you can see the link here, you can find the page by clicking by using the link that is on the screen now. They also have a milestone tracker app available for download. You just need to input the details for your child, and the app will help to track the development based on the details provided. And amazingly, they also share tips and activities for children at different age. So if your child hasn't met those milestones, they may have a speech or language delay. But bear in mind, developmental milestones help gauge your child's progress, but they are just general guidelines. Children develop at their own rate, but they should not differ too much from the milestones. Yep.
Okay, thank you very much for the insightful sharing, Ms. Lim. Yes, I think it is crucial for parents to keep track on their children's language milestone as they grow to ensure that they are progressing along the appropriate language development path. Okay, so Ms. Lim, we often hear the term of speech delay and language delay being used interchangeably. And could you explain to us the difference between these two terms and how they manifest in children's communication abilities?
Okay. Although the two are often difficult to tell apart and frequently referred to together, there are some differences between a speech and language delay. Okay, so speech is the physical act of producing sounds and saying words. So a toddler with a speech delay may try but have trouble forming the correct sounds or to make words. So a speech delay doesn't involve comprehension or nonverbal communication. So for example, a child with a speech delay can follow instructions well. They can answer questions by using gestures like head nodding, gesture full by touching the stomach, or ask a question with hand gesture, what or where. But on the other hand, a language delay involves understanding and communicating both verbally and non-verbally. A child with a language delay may make the correct sounds and pronounce some words. They have words, but they can't form phrases or sentences that make sense. They may have difficulty understanding others. So children can have a speech delay or language delay, but the two conditions sometimes overlap. So we may have a child with speech delay and language delay, and sometimes it's kind of hard to differentiate whether it's just one or and the two may exist together. So if you don't know which one your child may have, don't worry. It's not necessary to make a distinction, to have an evaluation and to start treatment.
Okay, great explanations about the difference between these two terms, Ms. Lim. I believe our audience now has a better understanding on how to differentiate between them. So, Ms. Lim, we understand that speech delay can have various underlying causes. Could you share with us some of the factors that can cause speech delay in children and how they may impact children's speech development?
Okay. So speech or language delay may mean that their development is a little different and they will catch up later. But speech or language delays can also be caused by a variety of factors, including genetic, hearing impairment, developmental disorders like autism, Down syndrome, or environmental factors such as lack of stimulation or exposure to language. So we learn to speak to get on the conversation. So it's very hard to pick on speech if no one engages with you. So there may be no other known physical cause, but it could be just an environmental factors that the child is not getting enough stimulation in their daily environment. Yeah.
Okay. All right. Thank you for the insight, Ms. Lim. Yes, it's crucial for parents to be aware of the potential factors that can affect their children's speech development. So, with this prevalence of smartphone and screen in our daily life, some parents may be concerned about the use of screen in young children overall well-being or development. So, as a speech language pathologist, what is your opinion on this matter?
Okay, let me just explain screen here. The word screen here refers to the use of digital media for entertainment on electronic devices. So it's for entertainment. So which include TV, smartphone, tablet, computer, laptop for the purpose of entertainment. So, due to MCO and COVID in year 2020 and 2021, children were exposed to digital screen far more than before, at a younger age and for a longer duration at that period of time. And the children we then assessed were found to have excessive screen exposure, so like 5 to 7 hours of screen time per day. And they may be only a few months old baby infant. So when we saw when we saw these children in our clinic, they all often presented with speech delay. They have poor interaction. They are active. Their attention span is relatively short with activities other than screen. So they could sit in front of screen for hours, but they can't attend to a play task or even meal time well, without the screen. And they had very limited skills in play or interest in play. And many research was done regarding the use of screen in young children because it's so common for young children to have their own tablet or their own smartphone. So, according to the research, for children younger than 5 years old, there is strong evidence that screen time has negative effect on weight, motor and cognitive development, social and psychological well-being. Okay, so then you may question, what is the appropriate amount of screen use? I have parents always come to me and ask me, so should I just take away their tablet or their phone? And it is very challenging for the parents to do that. So I would like to share one guideline for the use of screen from the American Academy of Pediatrics, the short acronym, which is AAP. So the guideline suggests no screen for children younger than 1.5 to 2 years old, except for video chatting. So, which is here. So family media use plan. So for children younger than 1.5 to 2 years old, avoid media use except for video chatting. And for children aged 18 months to 5 years old, the AAP recommends aiming for about 1 hour of screen entertainment per day. So, wow. Yeah, and the children I met in the clinic, they had screen time far more than the recommendation. Yeah. So, well, for children ages 5 to 17 years old, there's no standard screen time limit. But that doesn't mean kids can play game until 2 a.m. So the focus here is for parents to discuss with their children and prioritize key health factors. So like an hour of exercise a day, about 8 to 10 hours of full night sleep, time for homework, family time, and time that is completely screen-free. So after that, look at the time that is left and see how much seems reasonable for media use. Yeah. So I often share this guideline with parents, and I think they also have, an app or a checklist available, and you can actually plan the media use. They have a checklist for you to use with your children, where you can, fill in the details of your child and the time or the schedule of your child, and see, and they will suggest how much of screen time is suitable or appropriate, for that individual.
Okay, understand. Okay, great sharing, Miss Lim. Okay,
Did
so
I answer all of your question, Afika?
yes, true. You answer all of my questions. So great sharing, Miss Lim. So to help prevent speech delay and address it early on, what intervention or strategies would you recommend for parents and caregiver to use with their children?
Do you mean interventions available?
Yes, through interventions that are available for parents
Yeah.
or caregiver. Mm-mm.
Okay. Um, so if speech or language is the only developmental delay, then speech therapy may be the only treatment needed. Um, Sometimes parents may have to wait and see, or he will be okay after I send him to kindergarten, kind of thought. So this is when I see clients at the age of 5. So because they thought the child would be able to catch up, when they first noticed the problem uh, at the age of 2 or 3. So I would like to stress on the importance of early intervention. I always tell parents when children are younger, they learn language, they learn to speak. The children acquired at an early age is the foundation for learning. So
Yeah.
children with speech or language delay often struggle when they go to kindergarten, and when they don't catch up in kindergarten, the problem continues when they enter primary school.
True.
Yeah.
Mm-mm.
So research suggests that speech and language delays at 2.5 to 5 years of age can lead to difficulty with reading and writing in primary school. And speech delay can also lead to the problems with behavior and socialization. So early intervention can have a significant impact on a child's ability to learn new skills and overcome challenges to then increase the success later in school and future life. So it's very important for children, to start intervention as early as possible. There are kids that come to me at as young as 1 year old, or less than 2 years old. That's quite considered very early. Yeah, and we could see the children and the family members pick up a lot of skills, and the children will just improve very, very well, and they can then go to kindergarten, and they'll be able to learn with their peers in kindergarten. So whereas for children with diagnosis more than just speech and language delay, example, autism, Down syndrome, they may need extra support from occupational therapy, from physiotherapy, early intervention program. So the types of services required are based on the needs of the child and family. So it's very individual based. Yeah.
Okay, understand. So it is clear that early intervention is key in addressing speech delay in children. So it's important for parents to be proactive in their children's speech development and seek professional help if they suspect their children is experiencing speech delay. So with the right intervention and support, children can overcome speech delay and reach their full potential in communication. Okay, so Miss Lim, as we are coming to the end of our live session today, is
Mhm.
there any final advice or tips you would like to share with our audience regarding speech delay in children? Or is there any key takeaways that you want to leave with our audience to help them better understand and support their children's speech development?
Um, yeah, we are coming to the end. Okay, so
Mm.
here I would like to share with the audience on some tips to promote language development. So number one is to spend quality time and interact with your child. Um, Children can learn ABC, 1, 2, 3, colors, shapes, songs from YouTube. But for a child to communicate, they need someone to talk in order to learn how to use the language they hear in actual context. So it is very important for you to talk to your child in order for them to learn language. So when you talk to your child, if face to face, look at them, let them see your facial expression, let them see how you say the words so they can imitate the mouth movement better and clearer. So Tips number 3 is to monitor the use of screen for the purpose of entertainment. Yeah, or choose to be their media mentor. So co-view the media with your child to help them learn from what they are doing, they are seeing and saying online. And remember, no more than 1 hour per day for preschoolers. And finally, if you suspect your child may have speech or language delay, do not wait. Talk to a professional. So you could talk to teachers at your child's preschool center, speech therapists, and audiologists, a GP or pediatrician, or a clinical psychologist. They they will be able to provide advice whether your child needs further evaluation or if your child is developing at the milestone that is all right for the child.
Okay. Great tips and advice, Miss Lin. Okay, so thank you so much for sharing your knowledge with us today. So I hope that this discussion has been informative and has provided our viewers with a better understanding of speech delay in children. So please feel free to reach out or contact us if you have any questions or concerns. Thank you everyone for watching. Bye.
Bye bye. Thank you.